Welcome to Understanding Jaundice. Many late preterm babies develop jaundice during their first days of life. Understanding what jaundice is and when to seek help can help keep your baby safe. What is jaundice? Jaundice causes a yellow color to the skin and whites of the eyes. It occurs when a substance called bilirubin builds up in the baby's bloodstream. Why is it more common in late preterm newborns? Well, late preterm babies are more likely to develop jaundice because their liver is still maturing and may not remove bilirubin as efficiently as a full term baby. As your baby's caregiver, you can watch for yellowing of the skin, yellowing of the eyes, increased sleepiness, difficulty waking for feedings, or poor feeding. Frequent feeding can help your baby's body remove bilirubin more effectively. This is one reason why feeding every 2 to 3 hours is so important. Contact your healthcare provider if your baby's yellow color is becoming more noticeable, your baby is difficult to wake, feedings become difficult, or you're concerned that jaundice is worsening. Most cases of jaundice improve with monitoring and treatment when needed. Early recognition and follow up are extremely important. What if your baby's bilirubin becomes too high? Well, your healthcare provider may recommend a treatment called phototherapy. Phototherapy uses a special blue light to help your baby's body break down and remove excess bilirubin more quickly. Phototherapy is a safe and commonly used treatment for newborn jaundice. Many babies respond well to treatment and are able to go home once their bilirubin levels improve. To help phototherapy work as effectively as possible, it's important for your baby to remain under the lights as much as possible. The more time your baby spends under the phototherapy lights, the more effective the treatment will be. Your baby should continue feeding every 2 to 3 hours during treatment. Feeding helps your baby's body remove bilirubin through urine and stool, making it an important part of recovery. When taking your baby out for feedings, diaper changes, or cuddling, try to limit the total time away from the lights. Many healthcare providers recommend keeping babies out of the lights for no longer than about 30 minutes at a time, unless otherwise directed. Your baby's eyes will be covered with protective eye shields while under phototherapy lights. These shields are important to help protect your baby's eyes from the bright light. If you need to remove the eye protection, make sure the phototherapy lights are off first. A member of your healthcare team can help you if you have any questions about your baby's eye protection. Phototherapy works best when as much of your baby's skin as possible is exposed to the light. For this reason, babies receiving phototherapy are often dressed only in a diaper while under the lights. Some babies may also receive treatment using a billy blanket, a soft, lighted pad placed against the baby's skin. Your healthcare team will explain how to safely use this equipment if it is recommended for your baby. During treatment, your baby may need blood tests to check bilirubin levels. These laboratory tests help your healthcare team determine how well the treatment is working and when phototherapy can safely be stopped. Although your baby may spend a lot of time under the lights, you can still bond through feedings, gentle touch, and comforting interactions. Your healthcare team will guide you through the treatment process and answer any questions you may have. Once your baby goes home, continue to monitor for signs of worsening jaundice and contact your healthcare provider with any concerns. Before we finish, let's review some of the most important things we've discussed. These questions can help you think about what you've learned and help us know if we've explained things clearly. In your own words, what is jaundice? Jaundice is a yellow color that appears in the skin and eyes because bilirubin builds up in the body. Can you tell me why late preterm babies are more likely to develop jaundice? Late preterm babies are at greater risk because their liver is still developing and may remove bilirubin more slowly. Why is feeding every 2 to 3 hours so important when a baby has jaundice? Frequent feeding helps your baby's body remove bilirubin through wet diapers and stools. What signs of jaundice or worsening jaundice should you watch for at home? You should watch for increasing yellow color of the skin or eyes, increased sleepiness, and difficulty feeding. If your baby needs phototherapy, can you explain what the lights do? Phototherapy helps break down bilirubin so your baby's body can remove it more easily. What are some important things to remember while your baby is receiving phototherapy? These are some of the most important things you can do to help phototherapy work effectively. Keep baby under the lights as much as possible, continue feeding every 2 to 3 hours, limit time out of the lights to about 30 minutes at a time, keep the eye protection in place, keep as much skin exposed to the light as possible, and expect blood tests to monitor bilirubin levels. When should you contact your healthcare provider? Contact your healthcare provider if the yellow color appears to worsen, your baby is difficult to wake, feeding becomes difficult, or if you have any concerns. Remember, you do not need to remember everything perfectly. Your healthcare team is here to answer questions and support you throughout your baby's care. Understanding jaundice and knowing what to watch for can help you feel more confident and prepared to care for your baby. Thank you for taking the time to learn about jaundice and how to care for your baby. In our next video, we will discuss temperature regulation and safe sleep practices to help keep your late preterm baby safe, comfortable, and healthy.